You're listening to Health Innovators, a podcast and video show about the leaders, influencers, and early adopters who are shaping the future of healthcare. I'm your host, Dr. Roxy Mooney. Welcome back to the show, Health Innovators. On today's episode, I'm doing something a little bit different. Instead of having a single guest, I've invited three powerhouse rock star women who are driving change in healthcare. I've invited them today to have a conversation around personalized care models and the role that technology and data are playing. So welcome to the show.
Thank you for having us.
Yes. So today we have Danika Kelly, who is the CEO and co-founder of Normative. We also have Katherine Saunders, who's the co-founder of Intellihealth. And then we also have Swathi Arulguppe, who is the founder and CEO of BetterMeal.AI. Thank you so much for joining me today. So to get started, I thought that maybe you could each introduce yourself and say just a little bit about your background and what you're doing, and then we'll dive deeper into the conversation.
Great.
So Swathi, you get us started.
Great. Hey, everyone. My name is Swathi. I'm the founder and CEO of BetterMeal.AI. So BetterMeal is a therapeutic application that reveals biological connections between, gut health and food at the deepest level. And we use this intelligence to help reverse conditions like type 2 diabetes, thyroid, polycystic ovarian syndrome, endometriosis, celiac, IBD, etc. So I've been a data scientist before, but we started the company like 3 years ago, and the company was based on largest clinical trials where we have discovered biomarkers, for the first time for the gut health. And of course, we use this intelligence to help patients recover faster. Thank you.
Katherine.
Great. Thanks for having me again, Roxy. It's great to be back on your show. I'm Dr. Katherine Saunders. I'm an obesity medicine physician, and my expertise is in pharmacotherapy for obesity, which we now understand to be a disease and not just a lifestyle problem. So it really requires a medical model to treat effectively. I did all my training at Weill Cornell Medicine. I'm still on faculty there. And in 2019, my husband and I teamed up with my mentor, Dr. Lou Aroney, who is one of the pioneers of the field, to start our company Intellihealth. Our mission is to scale and democratize access to the kind of very comprehensive, effective care that we deliver. And we have a software platform and app called Evolve. We also recently launched our clinical services, which is basically a telemedicine practice, and that is called Flight.
Nice compliment to what Swathi's doing.
Mm-hmm.
And Danika.
Hi, everyone. So my name is Danika, and thank you very much for the nice introduction, Roxy. It's great to see some familiar faces here. So Normative is a female-focused health tracking software and platform. And effectively, our objective is twofold. So the first one being making it easier, more affordable, and more scalable to include and be representative of female health specific metrics. And on the user side, making it so that people are able to understand and learn and track how their hormonal variability impacts their health at a wider scale. So very much in line with some of the work that both Katherine and Swathi are doing.
Awesome. Thank you. So personalized care is one of the hot buzzwords today. One of you just share with us, what does personalized care mean to you? And what do you think it means to the marketplace, if there's any difference?
Sure. I think the personalized word is kind of, it's actually not personalized today, like wherever we see the use of personalized care. For example, with our solution, so we provide nutritional solutions as treatments, right? The way the nutritional solution, personalized nutritional solution had been used until today was so outdated, I can say, because, environment is changing, food is changing, literally the bioactives, which are like pretty much, the important things in the food, those are changing. So when somebody says that we are giving you a personalized solution, the nutritional solution, it kind of makes me think again and again, is it really personalized? Does it really work on my body? So those are the questions to be answered before thinking about anything or before using that word, personalized, because I think there is a lot to think about whenever it comes to health personalization. We are not yet there. There are so many things, so many aspects of it, but I'm happy that people are like trying to solve pieces together. And when all the pieces come together, that's what is called personalization, according to me.
Yeah, there's a lot of conversation around tech enabling personalized care. And so, in kind of just continuing the conversation, is technology the solution?
I think that's a really challenging question. I think Katherine can also speak to this as well as Swathi. But for my normative, there's a reason why we called it my normative, and it was around normative states of being and kind of statistical averages and whether or not you personally fit into some of those ways in which your health should occur. And so one of the big gaps that we saw in the market and why my normative bothered to exist was because when you get, and this one's really silly, but just as an example, if you're using an activity tracker, it's calculating your outputs effectively as a percentage of a male body, and not actually, even though it says you burned 862 calories. You didn't actually burn 862 calories. And the physiological impacts of that burn and how you burned that aren't accounted for. And so the health outcomes or outputs that might come through the work that you're putting into your health may not be what you think it is or what they are. And so my normative is really around trying to take some of those steps around improving personal care from a tech perspective, but even the fact that it's a tech perspective makes the impact a little bit limited.
So wait, am I burning more or less?
Depends on where you are.
Okay. Katherine,
you're going to say that? That's a great question, Roxy, because it brings up a good point. I mean, just because we can do things with technology doesn't always mean that, they're done exactly how they need to be. And this is, one of the premises for Danika's company. So technology can be helpful in so many ways, but there are also limitations. In our field in obesity, the reason why we started our company is because there's so few providers like me who know how to treat this. And there's so many people who need help. So we're like, oh my gosh, we need to use technology to solve the problem. We soon found out that there weren't enough providers available to even use our technology. So that's why we started our clinical services. But what we've basically done is created, algorithms. I've written algorithms, and we've continued to refine these to really take each patient and look at all of the characteristics that go into our decision making, and then make recommendations based on all of those very highly individualized, personalized characteristics, and make recommendations in terms of consider this medication, don't use this medication, use this medication with a caution. And so what we've been able to do is to deliver this kind of highly specialized thinking in terms of how to best tailor treatment and scale and democratize access by using technology to train more providers. So it's really exciting that we're in a time right now where we can really use technology to our advantage to improve the quality of patient care and also to improve access to patient care.
So there's certainly some obstacles that we are faced with as we trying to deliver more personalized care in each one of our domains of expertise here. And so we talked before about underrepresentation of certain populations. So what are some of those populations that are underrepresented, and what are some of the things that we can do about it?
I'm going to make a little bit of a snarky comment. So basically, anybody who's not the reference man, right? That 70 kilogram kind of 18 to 23-year-old white male is the basis for most. We adapt that person for most of the things that we do, whether that's an older male in a specific subpopulation or a younger one. Like children, if you want to talk about complicated medicine, I failed all of my children classes. Those were super hard. I don't actually fail, but like, don't ask. I did not do well. And those can be minority populations. Those can be hard to access populations. Those can be intersex populations, gender non-binary populations. There's basically everyone who isn't that reference man point, I think, is somebody who, when we talk about normative data sets, has a lack of representative care and equity in the space. I don't know if you two would agree with that statement. Just nods all around the table.
That means we agree.
Yes.
I mean, I think, for all of us, health equity is such an important focus. And so it's really exciting to be able to, really focus what we're doing in order to, tailor everything to, different populations that wouldn't be recognized for their differences and don't really fit the mold of other populations. So it's incredible that we have, technology in so many different ways to be able to include groups to have better research, and then have findings that are more applicable to wider audiences.
I wonder if we as consumers, so not as health care change agents, but just as consumers, even have awareness about these gaps in personalized care. I mean, even Danika, what you talked about, I have my Apple Watch on and I use this tracker and I feel really good about those metrics that I'm getting. So I wonder if consumerization is driving a lot of change in healthcare, but I wonder if there's still all of these areas that we're not even aware of, some of the gaps that we should be advocating to solve for.
I think that's a really good question. I can hop in first, but I would definitely love to hear your two perspectives. One of the big things when we started My Normative, the reason we didn't go direct to consumer as a company is because the general population writ large isn't aware from like a health education standpoint that they have hormonal variability, how their menstrual cycle works, how it'll change as they get older, how perimenopause and menopause works. And so trying to offer a solution to a population that is unaware when they consume materials and contents and goods that it was going to have a potentially inaccurate health impact or health assessment for them was just not a viable business model. And that is really problematic to me.
Mm-hmm.
Okay. I think from our perspective, and this is based on, BetterMeal. So the solution basically, if we had to have consumerization, we started with that. So we went directly to customers first. Now we are going to hospitals. So I think many people, who are suffering from autoimmune conditions like celiac or even like type 2 diabetes, they have hard time managing it. And we've interviewed a lot of them, hundreds, thousands of them, and we've seen a lot of them using disease management. And they were like, I do not want to manage my disease. My doctor is helping me out with that. Can you give me a solution so that I can just, heal the condition? Is there a solution? So I think for us, that was the right thing to do, where we went directly into consumerization. And in a way, I think I kind of agree with Danika, where the population whom we are giving our solution to, so they're aware and they're not aware. We have both equal mix. So I see a lot of them coming back with questions around, the nutritional solutions. Okay, what does this mean? Versus the other people who are super, super geeky about the food they eat. And they're like, oh my God, I'm getting this information and I'm so happy that, now I understand what I'm consuming. So I think in our case, we have that equal mix. And that is also a good starting point, because we get to know what people want and we can kind of modify the business model and make it viable for both the audience so that they're benefiting from the application completely.
Yeah, so we actually did not start as direct to consumer, and we're not. That's still not our business model, because the you know, as same with you guys, our customer base is so tremendous. We're in an obesity epidemic where 80% of the country has overweight or obesity, and that's just in the U.S. I don't know the Canadian numbers, Danika. So we are trying to power existing infrastructures to deliver care instead of going, one by one. But for us, it's really interesting, just because if you think about sort of the consumer, diet industry, every single patient who comes to see us has tried and failed and tried and failed and tried and failed. And that's because there's no one size fits all approach here. There's no one best diet. And so for us, our focus is really on sort of the medical intervention, but the cornerstone is still, for a healthy lifestyle and for overall health, to make sure that people are eating in sort of a reasonable, healthful way. But it's really about working with each individual person through providers to really get at, what are their preferences, what works for them, what doesn't work, and most importantly, what can be sustainable. And it's very hard to do that without, really listening to people and, making those connections and figuring out, people come in and tell me things all the time where, it's so funny. It's like, I can pick apart just by listening. And I think that just connecting the dots for them, where they're like, oh, wait, I feel this way because I eat this. And it's like, they tell me a clear story and it seems so clear to me, but it's really hard to make connections sometimes. So, having this really like personalized intervention, I think is so helpful in a way that, can't always be done in a consumer way, depending on what you're talking about.
Hey, it's Dr. Roxy here with a quick break from the conversation. Are you trying to figure out what moves you need to make to survive and thrive in the new COVID economy? I want every health innovator to find their most viable and profitable pivot strategy, which is why I created the COVID Proof Your Business Pivot Kit. The Pivot Kit is a step-by-step framework that helps you find your best pivot strategy. It walks you through 6 categories you need to examine for a 360-degree view of your business. I call them the 6 critical pivot lenses. As you make your way through this comprehensive kit, you'll be armed with the tools, tips, and strategies you need to make sure you can pivot with speed without missing out on critical details and opportunities. Learn more at legacy-dna.com/kit. Yeah, it also seems like there's this dichotomy struggle between personalized, where that seems very individualized, very one-on-one, which is not very scalable, right? And then we've got technology that helps us with being able to scale and being able to help more people and deliver our solutions to more maybe rural areas but is that personalized? So am I able to leverage technology to provide that one-on-one detail that you just described, Katherine, but also being able to help 10,000 or 200,000 people?
Yeah, that's a great point, Roxy, because, just because we have technology that can work well doesn't mean it's the best thing for everybody, but then how do you scale? So I think the answer, and what we're trying to do as a company right now, is to try to figure out what has to be delivered in a more kind of time-intensive, human capital kind of way, and how we can use technology to do absolutely everything that technology can. So we're fortunate to have technology kind of powering our clinical services. But as we scale, I keep, reminding our team, think about throughout the day what you're doing that could be done by technology, or what you're doing that could be powered and could be streamlined and just could save you time. So it's just incredible, these days, like what we're able to do with technology, but it's really, that, the intersection between the two, where you have to really strategically figure out what technology can and can't do.
Yeah, I think creating meaning for the patient is kind of number one on that list, or the person who's using the product. And it's something, so per Katherine's point, when my Normative was in its infancy, in its nascence, we went and we did a big consultation with a big women's hospital. And basically they were like, we can't use this data in a meaningful way. These insights, these analytics, it's not going to do much for us at this point. And so we had to really figure out, per Katherine's point, where is it meaningful to have this sort of longitudinal data and actualized data? And where in the system of impact and intervention does it fit? And for us, that ended up being on the CRO, the clinical trial side. And for us, the ultimate objective for impact and personalization is to help other people create policy design and procedure that would inform someone like Dr. Katherine's practice, so that then Dr. Katherine has more tools in her toolkit to provide personalized care. But my normative can't provide that. That's just, it's outside of the scope. If you have multiple confounding factors going on in your life that we can't account for algorithmically, that is when we have to say, you need to go see a health professional, right?
Mm-hmm. Yeah, I think that's a great point. I agree with both your points. I think when there is a physician, intervention, it should happen. It should not be completely dependent on your application. And also, I'm a data person. I truly believe data leverages the technology. Good data makes it stronger. So I think the need, if anyone is thinking about this, the first thing they need to question is, do I have that right data to start with? And for BetterMeal, we've made sure, that was the case. And our algorithm works personalized for each and every user using it today. So, for all the thousands and thousands of users, who are using our application today, we make sure the algorithm is personalized for each of them. And whenever there is a physician or even a dietitian on demand in need, we provide that through our, collaborations with doctors and dietitians. So in a way, the algorithm, as per Katherine's point, it's actually working personalized for each and every user. And whenever there is a need, there is physicians and dietitians both working the patients effectively to help them heal faster.
So you all kind of touched on a couple of things that come to mind is awareness, right? So you're each solving a different problem within the healthcare ecosystem, and there's varying degrees of awareness around this problem and around solutions for this problem. And then also figuring out where does it fit within that continuum of care, as entrepreneurs, we have to have a viable business model around these, right? None of you are running nonprofits. And so just talk about, as entrepreneurs, of figuring out that business model to where that you are bringing to market something, that a cause that you are very passionate about, but also where you meeting it in the marketplace and where someone is excited to actually solve the problem that you're addressing and willing to exchange funds for it.
Yeah, I think it's tricky probably for all of us in that we're all doing, we all have kind of a big scope, and we're not just solving a simple problem. Right. We're all working on really complicated, hard problems. So for us, for example, we have multiple different kinds of customers. So we have, medium and small health systems, medium and large health systems. We have employer groups. So we have pharma. We function a little bit direct to consumer, but that's not really our business model. But everyone has, there's different value for everyone. So, for patients individually, it's, health benefits. For, pharmaceuticals, they're trying to sell their drugs. For payers, they're trying to save money. For health systems, they're trying to save money, but also make money. So, we have a tricky time. I'm sure you guys have, similar stories trying to figure out exactly how to talk about, the value proposition when you're solving a problem that's so complex and affects people in such different ways.
Yeah. And I would add on to that, I think per all the stakeholders that Katherine just identified, that was learning the language of those stakeholders was one of the most important things that we did as an organization. We're still improving and iterating on that process because there are clear values and problems that my normative is trying to work towards solving. But the actual day-to-day concerns of the organizations that we work with are a little bit different, right? So in Canada, if you're going through the Tri-Council for research and you want to run a clinical study or an observational study, you need to hit specific metrics around equity, diversity, inclusion, belonging, and knowledge translation, dissemination, and engagement. And that's where my normative solves a lot of those representation and administrative problems for the CRO or the academic institution. It's nice that we can identify anovulation. That's not important. What they care about is getting that grant funding in. And so that's one of the things that we've kind of been working towards is, do you have this problem filling in this line on your grant application for $230 million? Here, let us help that be easy. And so finding those fits was a big change in how we talk about the product and how we create value that people are willing to exchange money for.
That's huge, because I think that some entrepreneurs never figure that out, or just struggle with years of facing the reality of that and embracing the reality of that.
Swathi?
I think it's really
I agree with Danika and Katherine, both of them. I think, once you go to stakeholders, I think it's a totally different game. And also, when you pitch this particular problem, you understand the depth of the problem actually when talking to stakeholders. I've, with my own experience, I found out that it's sometimes you need to kind of drag them back to the actual problem, because it can just get deviated and it might sound like, okay, this isn't a very small thing. It can be solvable. Why don't you think about this complex thing? But you need to actually kind of get them back saying that, no, look at this. This is the huge problem. And that's just a symptom of that problem. So I guess when you go to stakeholders, it's it's very tricky, definitely, because of a lot of I think a lot of possibilities around the problem you're trying to solve. So that might kind of deviate a lot of them. But actually, I think for entrepreneurs like us, we need to kind of stick through, and our job is to kind of drag our audience back and explain the situation today, not the 10 years or even 5 years down the lane. Today, if we are giving solution to a lot of people, I think that's what matters.
Mm-hmm. Yeah. So how are we overcoming some of these obstacles that we face? We've talked previously about financial incentives, and some of these problems, there's no financial incentives to kind of really be able to drive change in this. So from a real world insight standpoint, what are you guys encountering, and how are you overcoming that or addressing it?
I think just building on Swathi's comment, there are people who you tell them what you're doing and they just get it. They're like, yes, this is important. I'm ready to make moves in this area. And there are people who they're like, that's nice. That's outside of the scope of what I'm able to address right now. Or that would be really expensive to address. Or that's not a cost that I had considered when I was designing out or budgeting for this, right? Mm-hmm. And so for overcoming those financial incentives or those barriers to financial incentive. Yeah. And I think I touched on this just a little bit earlier. It's about finding those pain points, whether that be administratively, from a funding perspective, where there's a health economics unit, right? Where what you do will drive value from a health economics perspective, and then use that to ultimately generate the impact or the output that you want to have. I think from a business perspective, sometimes, especially with people who work in these kind of these populations that are traditionally underserved or underrepresented, there's a desire to put the impact up front as the business model. But sometimes, especially if you want to actually have that impact, it's about meeting people where they are, solving their day-to-day problems, and then being able to show impact at the end of that instead of putting the impact up first.
Definitely.
Totally. So then maybe one or all of you can share a story around your experience with being able to leverage personalized care and how it really made a difference. How is it, it could be one person or it could be a population, how there's something that you're doing that you're really, this is what's getting you up in the morning, right? Because you're starting to see a little bit of change and transformation that's happening from your work.
Yeah, good question. I see
sure.
I do my face
Sorry.
away. So many of the patients who we see, or the people who come to see us to help with their weight, have tried and failed so many times before. And even with some of the same strategies that we use, they've, just done it in a different way at a different time, and it just hasn't worked. And, I can't tell you how often we see people who are like, I've done this before, you can't help me. I've already tried everything that you can offer. And it's really, listening to their stories, and picking apart. For us, it's all about, what factors are pushing their weight up, what barriers are preventing their weight from coming down, and really tailoring our treatment plan to be very multifactorial, multifaceted, very comprehensive, to really target every single thing that we're able to change, and not just say like, oh, here's your one size fits all approach, and this is what we're going to do for you. And so the ability for us to be able to use technology to pull out all of these factors that are so personalized and so different for everybody. And then also acknowledging that, we're all, again, dealing with complex situations where different people don't respond as you would expect sometimes. So you can have the best technology in the world say, this is the best option for this patient, but there's still a lot we don't understand about what we're doing. And you have to just educate people in the right way to say, look, I have a really good feeling about this, and this is what I think will work. But if it doesn't, we have this backup and this backup and this backup, and just really being persistent and, continuing. And I think that that's been really helpful. A lot of what we're all doing is, solving hard problems again. And, people get frustrated and people are, discouraged, and, you have to just stay positive, and you have to, do a lot of education and, explain how we can leverage technology and how we use personalized medicine. But, there are nuances.
Mm-hmm. Yeah, I think for us, I wake up actually every day morning to a lot of like reports, like blood work reports from our users. So they send this comparison of, the HbA1c dropped in a month, or, for polycystic ovarian patients, like I was having a chocolate sized cyst and it's nowhere to be seen. All these kind of stories, it kind of like motivates me a whole lot. And some of them, like even write emails to me that I was really scared to consider, these are endometriosis patients. I was really scared to consider food as first line of medicine, but I'm so happy, like, this has healed me, and like, I'm in the way of recovery. And we don't even like address arthritis, but I think somebody who was using it actually, got a lot of like, support with arthritis, and they were able to walk again, like normally. It's a huge, huge thing for me. So I think all these kind of stories kind of motivate me on a daily basis that, okay, like what is the next best thing I can do to help these people recover? And I think that is what pushes me, gives me energy to do that. And I mean, like, food is a very tricky part. And once you start taking care of it, like, a lot of magic can happen. And I think these people are telling me stories every day that kind of surprises me myself that, okay, we are providing the solution, and it's kind of validating with a lot of people. So that's what kind of like, keeps me up in the night as well, that, okay, what is the best more I can do to help these people? And I'm like all excited in the morning because like I'm seeing all these results. So
yeah, I think everyone's hit it really well. But I think one of my favorite speaking points, especially when I'm talking to women in leadership positions, or women who hold kind of jobs where they feel like there's a lot going on, and the fascinating piece for me is my talking point is the most simple talking point, but through using my normative, I learned that when I'm cranky is not actually when normally people are supposed to be cranky. I'm cranky right after I ovulate. Don't know why, but it's consistent as heck. When I talk about mood and motivation tracking, I am a beast post-ovulation. I don't book meetings. I don't book meetings after that. I give myself a couple of days. Otherwise, if you want really good quality work, I will nitpick things to death and it will be perfect when it goes out the door. But I can do that paperwork on my own. So when I talk about this with professional women, they're like, I never thought about not booking meetings when I'm in a bad place, and kind of giving themselves the permission to understand maybe emotionally on a tracking level where they might be, and then personalizing that for their day-to-day kind of care, and not booking meetings when you're PMSing is one of my favorite outcomes.
Awesome. I love it.
Everyone
love
around
it
you.
because it's like the same story with all of us.
It is. Yes. It's safer for everyone, right?
Yeah, it is. It is. I do the same. I don't book meetings during those times when I feel I'm not in, the best moods because of this, reason. Otherwise, like I'm all energetic and I'm out there and I want to do more. But during that time, I'm like, okay, let's just take it slow.
I can't think of the company name, and I'm going to pull it up and I'll share it with you all after the show. But I just got an email in the last couple of weeks where an organization just started. All of their female employees were getting an additional 2 days off a month for this time that we're talking about as part of their employee benefits, and that they were encouraging more organizations to do something similar. And I thought I actually almost fell off my chair because I just thought I'd never in a million years think that something like this would be happening at the organization level. I think it's exciting, the change that we're starting to see happen as we chip away some of these very, very difficult problems. So I want to thank each one of you for joining me today, for having shedding a little bit of light on some of the difficulties and complexities of solving these problems in healthcare, and sharing the challenges and also some insights on how we're going to overcome them. We talked about this before we started hitting record. There's so much for us to still talk about personalized care and technology-enabled personalized care. So I'm sure we'll do more episodes together in the future. But thank you so much for joining me today.
Thank you for having us, Roxy.
So much, Roxy. Yeah.
Thank you so much for listening. I know you're busy working to bring your life-changing innovation to market, and I value your time and attention. To get the latest episodes on your mobile device automatically, subscribe to the show on your favorite podcast app like Apple Podcasts, Spotify, and Stitcher. Thank you for listening, and I appreciate everyone who shared the show with friends and colleagues. See you on the next episode of Health Innovators.